According to Hennepin County, quote, "The jails and correctional institutions are seeing high volumes of clients with unmet behavioral health needs. Hospital beds are operating at capacity, filled with clients with behavioral health issues. The largest drivers to health care are behavioral health gaps, and access to services for adults with behavioral health concerns is limited. The system is spending tremendous money for crisis services with limited benefit to those we serve," end quote. A similar statement can probably be made by every other county in Minnesota. Obviously, effectively addressing behavioral health issues is a major public health challenge. That's why we'll be addressing it on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at an innovative program in Hennepin County to work across numerous county programs to more effectively address the behavioral health issues that are overwhelming our legal, health, correctional, law enforcement, educational, and social service systems, to name just a few. Addressing behavioral health issues is one of the biggest public health challenges that we face. Joining me in this discussion is Leah Kaiser from the Hennepin County Human Services and Public Health Department. Leah is the county lead on the Criminal Justice Behavioral Health Initiative, which is aimed at improving the coordination of criminal justice systems and behavioral health services to ensure that public safety, human services, and health services leverage resources across county systems to improve client outcomes. Leah has a master's degree in forensic psychology and has 25 years of experience working with homeless, mentally ill, chemically dependent, and criminally involved youth and adults. Leah, welcome to our program.
Thank you.
And we want to talk about this innovative program that you have, but I want to spend a little bit of time sort of getting an idea, what's the problem that we're really addressing? What are the issues? And I want to start first of all, with your background in master's degree in criminal psychology. What is that field, forensic psychology?
Mm-hmm. Well, I guess the easiest way to describe it is that forensic psychology is sort of the interplay of psychology, so the study of mental health, mental illness, and its interplay with the criminal justice system, so law.
Okay. So this must be a field that there's lots of issues. So what do you see, what are some of the issues that you're seeing in this field?
Well, fortunately, I think the field is evolving. It doesn't have a really long history. I mean, it's only 40 or 50 years old. But when we look at the criminal justice system, of course, there's been individuals that have had mental illness or substance use disorders that have been involved in our legal system forever, right? But there's a lot of pointing through the literature and the like that shows a correlation between deinstitutionalization and homelessness and other social determinants that have brought people into the criminal justice system, which I think when you hear, that the jails have become the number one, mental institution of our country, there's a lot of people that point to that. The other thing that I think has been a real driver of this has been the criminalization of substance use disorders. With different laws being passed, there was an incredible uptick in our jail population of people that suffer from alcoholism and chemical addiction. So those two have been pretty significant. But in our field, so when you look back at the mental health field, that was kind of separate from the chemical health field. And since we have evolved in our own practices and our own disciplines through research and the like, we have learned quite a bit about comorbidity. And now you're hearing terms like behavioral health instead of just mental health. And that is a reflection of our evolution in this. And as our fields have evolved, they have helped inform policy and practice over in the criminal justice side. I think a great example of that I point to is the introduction of, do you know what problem-solving courts are? So like drug court or veterans court or mental health court. Those are a direct reflection of new learnings that have come out of the behavioral health field, right? That have had an implication on what should be working and what should be in place for the criminal justice system. So.
So the quote that I used from Hennepin County right at the beginning when I introduced this is that behavioral health issues seem to be overwhelming all of our systems, our legal systems, our criminal justice system, our medical system, our mental health system. You mentioned some of that. You got drug use and the criminalization of that. Are there other issues that are bringing mental health issues to the fore now? Are there changes in our society? Are there things that we are identifying that we didn't identify before, or approaches that we were taking in the past that we're no longer taking to prevent some of these things from occurring in the first place?
Yeah, I mean, I mentioned that the field, the behavioral health field is evolving quite a bit in its understanding, which is helping to shape some of these policies. But, I think actually money has been a big driver of this, as we have started to either lose or have shrinking resources. There has been a concerted effort to target our interventions towards things that work and away from things that don't work. And on the one hand, it's been very difficult for systems, especially government systems, to respond to shrinking resources. But on the other hand, it is provoking us to do things very differently. And there's a lot of opportunity in that. When you start to look at the systems, we were chatting earlier here about when you look at the systems, I was using the example that, if I'm coming at a problem, a systems problem or a long-standing problem from my lens, my perspective in the human service sector, I don't have the advantage of understanding how that might play out, some of the decisions that I make to solve those problems, how that might play out, say, in the health sector or in the criminal justice sector. And I think what is starting to change is that we're seeing the same individuals moving through all those systems, and so it is starting to call attention to the fact that I can't solve a problem in my own silo, nor can you, and from a health standpoint, and nor can somebody coming at a problem, a systems problem from the criminal justice standpoint. We all have to start to see the problem more collectively and look across these systems for more innovative answers. So that's what we're trying to do in Hennepin.
Are the issues in Hennepin County any different than they are in Pope County or Anoka County or New York City or Los Angeles? So these are issues, they're not urban, rural, one state or another?
No, there might be some different issues, in the rural, they don't have the wealth of social service treatment programs and the like that's locally available, and so they have other related issues, around transportation and trying to get people access to services that we might not necessarily have here in Hennepin. But we have capacity issues here in Hennepin. So different issues, but it's the same kind of systems problems.
Okay, and I know we've learned a lot about how to treat mental illness and behavioral health. Shouldn't that be, since we're better at it than we were 20 years ago, shouldn't things be getting better because of that than what it sounds like they're in sort of a crisis mode right now?
Yeah, I think these will be very these are very long-standing problems that it's going to take, again, moving outside of, say, just responding from a mental health standpoint. So, for example, we have solid evidence about what works to treat somebody's mental illness. There are still systems gaps with, say, housing or with employment, and same thing in the criminal justice universe. So, there's lots of evidence about what works to help, curb offending behavior, but those systems, so if there's a high risk around mental illness or chemical dependency, you have to start to cross over into other disciplines. So really the next thing in front of us is not just treating the mental illness or the chemical dependency, it's moving across all those other systems.
All right, so that gets into what your program is all about, and we're going to talk about that in this next segment. But first we need to take a little break. We'll be back right after this message.
Pretty much a good day for me would be people leaving their hands off of me. I'm always called names. Everywhere that I go, there's always someone calling me names, calling me gay. I've been choked, thrown up against a wall, punched. Nobody's ever tried to help me.
welcome back. We're talking with Leah Kaiser from the, excuse me, from the Behavioral Health and Criminal Justice Initiative in Hennepin County. Leah, you talked about, the systems change, and we've got a couple of slides here that sort of graphically, outline what the issues are, the approach that you're taking. So explain a little bit about what's on the slide here right now that kind of shows a little bit about what you're doing in Hennepin County.
Yeah, well, I like the word that you used around an integrated approach. I mean, this is very, very much what we are driving towards in Hennepin. What you see up on the slide here is what we're calling a behavioral health recovery center. And what's different about this is that it is bringing together a variety of disciplines and services to leverage towards this particular issue. And so what we have up here is a concept that is coming up elsewhere in the country, whereby we want law enforcement, when they come into contact with somebody that might be having a mental health crisis, to have a point where they could bring that individual, instead of bringing them to jail, could they in fact bring them to a drop-off center or a behavioral health recovery center where there could be an immediate assessment of their need. We could try to determine, do they need housing? Do they need food? Do they need a sobering center of sorts? Do they need to detox from something that they might be taking? What kind of medical care do they need? And we could do a very quick assessment of their need and then hook them up right on point with the services. Instead of what happens now is kind of moving them deeper into the criminal justice system, booking them into the jail, and then the system just kind of moves that individual through something that that will probably send them back out onto the street, only then to have, if they have a mental illness, further deterioration, and then possibly into the hospital. We see a lot of cycling of individuals moving from our shelters, our emergency room, and back into the jail, and they just kind of spin through that cycle. The model that we were trying to describe is an opportunity for us to break that and to bring to bear all of the different services that we have as a county to try to hook them up with community resources instead of bringing them deeper into our system.
Yeah, so this sort of is what happens to an individual who comes into the system. Do they need urgent care? Do they need primary care? Do they need behavioral health services? So on an individual, and so you have an integrated approach for that individual. But let's step back more to the systems level. All right, so you've got a whole bunch of systems. How do you bring those systems together that can affect all of those systems? How do you bring the housing system together? How do you get criminal justice in there? How do you get the big systems to play in a collaborative way? And Hennepin is probably the best example of where that really is needed, because the largest county with a lot of issues. How do you bring that together? How do you make that happen?
Well, I think the first thing is awareness. I mean, you'll hear from Sheriff Stanek talk quite a bit about the mentally ill that are confined in the jail. You'll hear the same thing when you talk to individuals in our hospital system. So Hennepin County Medical Center talks quite a bit about individuals with mental illness that are also involved in the criminal justice system. And so what's happening is you're starting to raise the awareness across all these various system players, and it's being elevated up, to the very top of our leadership. So, you have our county administrators, you have our chief public defenders, you have our chief city attorneys, our county attorneys, the sheriff, human services and public health. So you have all these entities that are starting to recognize that we have a systems problem, and they have come together in a very intentional way to say, okay, well, what are we going to do differently? We can no longer afford to do the same old, siloed approach. What are we going to do differently? And so last year, one of the Hennepin County Commissioners launched this collaborative initiative that now I am leading for Hennepin, and we have incredible stakeholder support for this. That's where I think it starts. Okay,
so what needs to change in each of these systems to actually pull together to make this, behavioral health and criminal justice initiative work? What kind of changes in their approaches?
Yeah. There's a couple different levels, I think, to answer that question. One is policy, one is procedure, another is funding, and then service development. So, I mentioned earlier that Hennepin County has quite a bit of services available to us in Hennepin, but they have to be tailored just a bit to respond differently to individuals that are in the criminal justice system. And same thing for the criminal justice system. There has to be a tweaking of sorts in our policies and procedures. And so that's kind of what this initiative is trying to bring about. We're looking kind of across the system at large to say what's working, what doesn't work, and where do we need to change policy, funding, procedures, and develop services that some of the services just don't exist. So the stakeholders went through a kind of like an environmental scan and a gap analysis, and what we discovered was that in certain areas we have sort of this all or nothing approach. If you come into our system, you might get nothing until you hit a certain very high threshold from a system standpoint, and then you get a lot of services. What we need to have is an array of services across a larger continuum that can meet your individual needs, because we want to be able to recognize and have a sensitivity and a flexibility in our system so that no matter what the individual needs are, we can respond appropriately at the time that they first touch our system, instead of waiting until they end up in a state prison or in a state hospital to try to then repair or get them back into the community.
What kind of evaluation are you doing of this? How will you know if you're successful in getting these systems to work collaboratively together?
That's complicated. This is probably one of our biggest challenges, is this issue of data collection and data sharing across systems. We are taking kind of an eclectic approach where the outcomes that we're driving for is not just a health outcome or a public safety outcome. We have all banded together to have outcomes that are cross-sectional. So we want to see increased public safety, we want to see reduction in healthcare costs, and we want to see increase in community-based program utilization. To pull that information together is very tricky. Our own data systems don't talk well to one another, and so it's not a clean approach to try to extract what is working well and what isn't. But we're on the right path. I mean, there's a lot of national attention being given to this, and there's a lot of people across the country, systems across the country, that are doing fabulous work that we have the benefit of using to help inform our decisions here. And then we're on our own course too, because whatever is going to work in New York City isn't necessarily going to apply directly in Hennepin. So we have our work cut out for us to try to tailor things specifically for our unique set of circumstances here in Hennepin.
Well, I want to talk about sort of where we're going with this in the future, but first we need to take another little break. We'll be back right after this message.
Get caught buzzed driving, and you could do some hard time.
Craig, knock it off.
Sorry, Mom.
It could cost you around $10,000 in fines, legal fees, and increased insurance rates. And that could set you back a few years. Buzzed, busted, and broke. Because buzz driving is drunk driving.
Welcome back. We're talking with Leah Kaiser from the Hennepin County Human Services and Public Health Division Program Department. Okay, and she's the lead in the Criminal Justice Behavioral Health Initiative. Leah, we've talked, I think fairly generally about sort of the theory and the approach that you're taking. Let's be a little more specific. What would happen if somebody enters the criminal justice system now with some major behavioral health issue? Yep. What would happen to that person?
Yeah. So one of the most, I think, exciting initiatives that we launched in Hennepin over this last year is what we call an integrated access team. This is a great example of where the Human Services and Public Health Department is partnering up with the Sheriff's Office. Human Services and Public Health redeployed a multidisciplinary team of social workers, housing specialists, chemical health counselors, community health workers, and we moved them inside the jail, the Hennepin County Jail here downtown. And what happens is, the individual comes into the jail, they're booked into the jail. Our team then identifies high risk, high need individuals. So high risk to come back into the jail, high need from a clinical standpoint. And what we do is we make ourselves available to them. First we go into our data systems. We talked about data. We go into our data systems to see if these individuals have, maybe they're open elsewhere in the system. You know, the sheriff's office doesn't know that, but we do. So we go and we find out, is there a caseworker that's already open, and we get in touch with them to say, hey, look, you have a client that was just booked into the jail. We want you to come in and work with them. If they're not opened elsewhere in the system, but we know that they may have some mental illness or chemical dependency, we offer services to them. And if they're willing to work with us, we'll make contact with them while they're still in the jail, and we'll continue that relationship for up to 90 days after they've been released into the jail. So we kind of tag along with them. We follow them out into the community post-release, and our job, of course, is to keep them connected to us and hook them into community-based resources, so housing, employment, mental health therapy, case management, etc., chemical health treatment. And the intention, of course, is to break that cycle, get them stabilized in the community so that they don't come back into the jail.
Mm-hmm. Now, I know Hennepin Health is doing a similar kind of thing with really high-risk clients, their patients that they see. Are you linked with that? Are you learning from what they're learning?
Yes.
They bring housing and social service together on medical users and homeless in particular. Yep. Are you finding the same, learning from what they're learning?
We are learning together in all of this, yes. So, so Hennepin Health has, up to this point, been a program that has primarily targeted single adults and very poor single adults. Well, we know that there's very poor single adults that are also in the jail, and so again, we are trying to work together to identify, is this a Hennepin Health client, and are they doing some innovative things? So we want to bring them into the picture. If they're not on Hennepin Health, we want to make sure that they get on some kind of healthcare program. So part of this integrated access team in the jail, we partnered with 2 healthcare navigator agencies to come into the jail and help inmates apply for healthcare benefits. So if they're on Hennepin Health, they will have all the advantages of participating in that program. And if they're not, we will make sure that they hook up with one of these other healthcare providers.
Mm-hmm. Are you learning from other states or other places doing the same kind of thing that you're trying to do here?
Yes, so we mentioned that drop-off center, that multi sort of service center that that law enforcement could bring individuals that they encounter that might have experiencing a mental health crisis. A team of us, so it's not just the human service department, it's human services, corrections, the sheriff's office, Hennepin County Medical Center. We are all going on road trips of sorts. We are headed down to Orange County, Florida at the end of March here. Are we in March? Yes. End of April to go down and take a look at how they've set up their service array. And then we're also going to Texas, and we're looking across the country at similar models again to kind of see what's working for them, what can we learn from them, and what can we tailor back here in Hennepin.
So you've been doing this for about a year or so. Mm-hmm. What have you learned, and what have you seen as the biggest barriers or the biggest challenges that you've got?
Yeah, these are really large systems, and the funding streams are very complicated. There are hidden barriers all over the place, especially around policy and funding, and then data, kind of swoops in that causes some additional challenges. But the funding streams and there's gaps in funding for individuals. For example, if I were going to release somebody from the jail, I would love for them to be able to access services and almost have like dedicated resources. Well, there's federal regulations around how to access these various federally funded programs, and some of that causes us some challenges around how to
So a lot of these are policy issues, mm-hmm. and a lot of the policies were put together when things were in their silos, yes. working separately. What would be some policy changes that you would like to see happen to actually make this work better?
Mm-hmm. That again is a bit of a complicated question, but I would love to be able to see flexibility around community-based resources and federal funding streams, so that we can prevent some gap funding problems that we have to access services. There's a lot of barriers around housing for individuals with with criminal backgrounds, disincentives for landlords to support individuals that are coming out of the correctional world. There's policies and procedures around unlawful detainers that make people ineligible for different work opportunities and housing opportunities that I think create some additional challenges. So there's a lot kind of to be untangled.
Yeah, well, this is fascinating. It's a huge issue.
Yeah.
It sounds like you have an innovative approach. I'd love to have you come back in a year or so to see where you are in that process, because I think it really is the approach that needs to be made with this huge issue. So thanks for being with us.
Yeah, thank you for having me.
Good. And I'll be back with a closing comment right after this message. We know that as a community, we will never be able to treat ourselves into health. The needs are just too overwhelming. Nowhere is that more evident than in the area of behavioral health. We don't have enough resources or the systems in place to treat all of the problems that exist. That doesn't mean that we shouldn't expand access to care or modify our systems to be optimally effective. It's crucial that we do that. The Criminal Justice Behavioral Health Initiative in Hennepin County is a great example of some of the innovative approaches being taken to maximize the effect of our efforts. But while we're working on improving early identification and treatment of behavioral health problems, we must also focus on how we can prevent these problems in the first place. We need to find ways to reduce the demand and the need for behavioral health care. That'll require us to focus on some of the economic, social, and environmental factors that lead to poor mental health. Things like economic security, safe and secure housing, safe neighborhoods, good educational systems, and food security. While we look to behavioral and social service professionals to address the treatment issues, addressing the economic, social, and environmental factors are the responsibility of all of us. These factors are mostly impacted by policies at the federal, state, and local levels. As citizens, it is our job to educate our policymakers about these issues and hold them accountable for making the policy changes necessary to help prevent the development of behavioral health problems that are overwhelming all of us. As you've often heard me say, public health is what we do collectively to assure the conditions in which people can be healthy. Thus, it's the job of each of us to impact the conditions that lead to physical and emotionally healthy communities. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.